what the color of my stool says about my health. When it comes to figuring out how healthy we are, the color of our stool is a surprisingly informative indicator. Each color change ties back to different parts of our digestive system and what's happening inside our bodies. While a range of browns is typically normal, hinting at a healthy digestive process, other colors like red, black, or white may be red flags, suggesting things like internal bleeding or liver issues. Understanding these signals may help you better manage your health and know when it might be time to check in with a healthcare provider. In today's video, we will talk about 10 different stool colors and structures and what those say about your health. But how do you ensure a healthy bowel movement? Watch the video till the end to find out the secrets to keeping your bowel movements healthy and normal. 1. Brown stool. Brown stool is generally a sign of a healthy digestive system. The characteristic brown color comes primarily from bile, a fluid produced by the liver that helps digest fats. When food passes through your digestive tract, bile and enzymes break it down, facilitating nutrient absorption in the small intestine. As the digested material moves into the large intestine, water is absorbed and the remaining matter forms stool. The longer stool stays in the intestines, the more bile pigments are broken down by bacteria, turning it from green to brown. This natural process indicates that your digestive organs, particularly your liver and gallbladder, are functioning well. The liver's production of bile and its subsequent storage in the gallbladder are essential for fat digestion. A consistent brown color may suggest that these processes are happening correctly, without disruptions. It also reflects good transit time, meaning the speed at which food moves through your digestive system is neither too slow, which may lead to overly hard, dark stool, nor too fast, resulting in lighter or differently colored stool due to insufficient bile pigment alteration. Additionally, the uniformity of brown stool in terms of color and texture points to a balanced diet and adequate hydration, which are crucial for maintaining the health of your digestive tract. Experts advise consuming about 25 to 30 grams of fiber daily to maintain a healthy bowel movement. 2. Green stool. The most common reason for stool to appear green is the speed at which it passes through the digestive tract. Bile, which is initially green, is produced by the liver to aid in the digestion of fats. As it travels through the intestines, chemical reactions change the bile pigments from green to yellow and eventually to brown, a process primarily facilitated by enzymes in the gut. If stool moves too quickly through the intestines, such as during an episode of diarrhea, these pigments don't have enough time to undergo their normal chemical transformations. The result is a stool that retains much of the original green color of the bile. Eating foods rich in green pigments, such as leafy vegetables or foods with green coloring, may also turn stools green. Foods high in chlorophyll like spinach, kale, and broccoli are known for their deep green hues, which may tint the stool. Additionally, artificial colorants in processed foods and beverages have the same effect. These are non-toxic and pass through the digestive system without being fully absorbed, thereby imparting their color to the stool. 3. Yellow stool. Yellow stool may be somewhat unusual and often signals specific changes or conditions within your digestive system. Primarily, yellow stool might occur when there is an excess of fat in the feces, a condition known as steatorrhea. This happens when the body fails to break down and absorb fats properly. The key reason for this malabsorption may be an insufficiency of enzymes produced by the pancreas, which are necessary for breaking down fat. When fats aren't adequately absorbed, they give the stool a yellow, greasy appearance and may make it smell particularly unpleasant. Another common cause of yellow stool is a rapid transit time through the digestive tract. Similar to the green stool phenomenon, if food moves too quickly through the intestines, it may not have sufficient time to undergo the normal processes that result in the typical brown color. This rapid movement may prevent bile, which has a yellowish hue when not fully processed, leaving the stool yellow. Diseases affecting the liver, gallbladder, or pancreas may also lead to yellow stool. For instance, if the liver is underperforming, or if there is a blockage in the bile ducts, such as from gallstones, the process of bile affecting the stool's color may be disrupted. Conditions like hepatitis, cirrhosis, or pancreatic disorders affect the production and flow of bile and digestive enzymes, directly influencing stool color and consistency. Furthermore, certain infections, particularly those involving the gastrointestinal tract, may cause yellow stools. Infections disrupt normal digestion and may lead to increased stool transit times or affect the way food is absorbed and processed. For example, a common cause is giardiasis, an infection caused by the giardia parasite that affects the small intestine and may lead to yellow diarrhea. Since fat intake may directly contribute to this poop color, adults should aim for a dietary fat intake that comprises about 20% to 35% of total daily calories. One may focus on sources of unsaturated fats like avocados, nuts, and olive oil for better health. 4. Black or tarry stool. If more than 100 milliliters of blood are lost from the upper gastrointestinal system, black, tarry stool is observed. This includes the stomach, esophagus, or the beginning of the small intestine. The black color typically results from blood that has been digested, which turns it dark, a process known as melena. The tarry consistency and dark color occur because the iron in the blood changes form when it's exposed to stomach acids and enzymes, leading to a black, sticky substance. Several conditions may cause upper GI bleeding that leads to black stool. Peptic ulcers are one common cause. These are sores on the lining of the stomach or the first part of the small intestine that may bleed. Another cause is gastritis, which is inflammation of the stomach lining that may erode it and lead to bleeding. Conditions like esophageal varices, which are swollen veins in the esophagus that may burst, also contribute to this symptom. Aside from issues within the GI tract, certain medications may lead to black stools. For example, iron supplements are known to darken stool color, but in such cases the stool is usually not tarry and doesn't have the same foul smell associated with bleeding. The appearance of black, tarry stools should not be ignored, especially if it is accompanied by other symptoms like abdominal pain, lightheadedness, or vomiting. It's crucial to seek medical attention, as timely diagnosis and treatment are important. 5. Red stool. Red stool may often be a startling discovery, as it may suggest the presence of blood, which may signal a range of health issues. When the red color in the stool is due to bleeding, it usually indicates a condition affecting the lower gastrointestinal, GI tract, such as the colon or rectum. Common causes of bleeding in these areas include hemorrhoids, which are swollen blood vessels that may bleed during bowel movements, and diverticulosis, which involves small pouches that may form in the wall of the colon and bleed. More serious conditions, like colorectal cancer or inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, may also cause bleeding that results in red stool. In these cases, the blood has not been digested, unlike with black stools, which is why it maintains its red color. It's important to consider the appearance of the red color in the stool. Bright red blood often indicates active bleeding in the lower intestines or near the anus, while darker red might suggest bleeding higher up in the colon. In a study involving 40 children with bacterial diarrhea, blood, mucus, and pus were found in their stools. If the stool appears red and there's no dietary explanation, medical attention should be sought to determine the cause. Symptoms like pain, weight loss, or a change in bowel habits accompanying the red stool further underscore the need for evaluation. 6. Pale or clay-colored stool. Pale or clay-colored stool may be unusual and is often a sign that there may be something not functioning properly in the digestive system. This light coloring is typically due to a lack or absence of bile in the stool. Bile is a digestive fluid produced by the liver, stored in the gallbladder, and released into the intestines to help digest fats. It also gives the stool its characteristic brown color. When stool appears pale or clay-like, it usually indicates a problem with bile flow. There are several reasons why bile might not make it into the intestines. One common cause is a blockage in the bile ducts. These ducts carry bile from the liver and gallbladder to the small intestine. If they become blocked, bile cannot pass through and is kept from mixing with the food waste, resulting in pale stool. Blockages may be due to gallstones, tumors, or inflammation of the bile ducts. Another reason for pale stool may be liver diseases, such as hepatitis or cirrhosis, which impair the liver's ability to produce bile. Without sufficient bile production, the stool may not achieve its normal brown color and instead turn pale. Additionally, conditions that directly affect the gallbladder, like cholecystitis, inflammation of the gallbladder, may also reduce or block the flow of bile. Apart from that, as liver function declines in patients with hepatocellular jaundice, their stool color may shift to clay, reflecting impaired bile excretion. However, if clay-colored stool in a jaundiced patient tests positive for blood, it could signal severe issues such as cancer of the pancreas or the ampulla of Vater. 7. Blue-colored stool. The primary reason for blue stool is the consumption of foods, beverages, or supplements that contain blue dyes. These artificial colors are found in products like candies, frosted desserts, drinks, and certain medications that use blue coloring to enhance their appearance. In fact, in a study, researchers asked participants to eat a standard diet for one day. The next day, the participants ate 2 muffins colored with royal blue food dyes. Eating these muffins eventually turned their stools blue. The dyes are generally not absorbed by the body and may pass through the gastrointestinal tract unchanged. When large amounts of these blue-colored products are consumed, the dye may mix with the digestive contents and impart a blue color to the stool. Another less common factor that may cause blue stool is a condition known as porphyria, a group of disorders that result from a buildup of natural chemicals that produce porphyrin in your body. However, this is a rare condition and typically presents with many other symptoms beyond blue stool, such as skin issues, abdominal pain, and neurological complications. It's also worth considering children's exposure to non-food items. Sometimes children might ingest small amounts of products like crayons or colored pencils, which may lead to unusually colored stools, including blue. In such cases, the presence of blue stool may be a useful indicator for parents to understand what their child might have ingested. In most cases, blue stool isn't a sign of a health problem, especially if there are no other symptoms, such as abdominal pain, changes in bowel habits, or weight loss. However, if the stool remains unusually colored without any clear dietary reason or if other symptoms are present, consulting a healthcare provider is a good step. 8. Bright orange stool. One of the most common causes of orange stool is the consumption of foods high in beta-carotene or artificial orange coloring. Beta-carotene is a natural pigment found in many orange-colored fruits and vegetables, such as carrots, sweet potatoes, and pumpkins. When consumed in large amounts, beta-carotene may color the stool orange because some of it passes through the digestive system without being fully absorbed. Similarly, food items that include artificial colorings, like some candies and processed foods, may also result in orange stools. Certain medications and supplements may also cause orange stools. For example, antacids containing aluminum hydroxide may change stool color, and some medications used to treat infections or inflammatory conditions in the digestive tract could have a similar effect due to how they interact with other digestive processes. If you notice a sudden change to bright orange stool, it's useful to consider your recent diet and any new medications or supplements you've started. Typically, if the orange stool is linked to food intake or medication, it will return to normal once those elements are no longer consumed. Otherwise, ask for medical intervention at the earliest. Let's discuss some daily habits to maintain healthy bowel movement. Maintaining healthy bowel movements is crucial for overall digestive health and may be influenced by a variety of lifestyle and dietary choices. 1. Increase fiber intake. Dietary fiber helps to bulk up your stool and makes it easier to pass. Consuming a variety of fiber-rich foods, such as fruits, vegetables, whole grains, and legumes, may help. Aim for 25 to 30 grams of fiber per day. Soluble fiber, found in oats, apples, and beans, absorbs water and helps soften stool, while insoluble fiber, found in whole grains and many vegetables, helps add bulk and speed the passage of food and waste through your gut. 2. Stay hydrated. Drinking plenty of fluids is essential, as water helps dissolve soluble fiber and allows the bowel to move easily. Aim for about 8 to 10 cups of fluid per day, more if you're active or it's hot. Water is best, but other fluids like herbal teas may contribute to your daily intake. 3. Exercise regularly. Physical activity helps increase the muscle activity in your intestines, so try to get regular exercise. About 30 minutes of moderate aerobic activity such as walking, swimming, or cycling most days of the week may help keep your digestive system functioning effectively. 4. Mind your diet. Besides fiber, your overall diet may affect bowel health. Limit your intake of highly processed foods, which often contain high amounts of fats and sugars with little fiber. These may slow down digestion and lead to constipation. 5. Establish a routine. Your body may benefit from regularity, so try to go to the bathroom at the same time each day. This may help establish a regular bowel habit. For many people, this is often after a meal, as eating stimulates the bowel. 6. Limit stress. Chronic stress may impact your digestive system, leading to changes in your bowel movements. Techniques such as mindfulness, meditation, yoga, or simple breathing exercises may help manage stress. 7. Be careful with laxatives. While laxatives may help relieve constipation, regular use may lead to dependency and potentially damage bowel function. Use them only under the guidance of a healthcare provider. 8. Monitor your bowel movements. Keep an eye on what's normal for you and note changes in frequency, form, and color of the stool. Sudden changes may indicate an issue that might require medical attention. 9. Consider probiotics. These beneficial bacteria may help balance the gut microbiota and are found in fermented foods like yogurt, sauerkraut, kimchi, and supplements. They may be particularly helpful if your bowel irregularity is related to antibiotic use. While stool colors may provide insight into health, they should be considered alongside other symptoms like pain, frequency, texture, and overall health status. Persistent changes in stool color, especially black or red stools, should prompt consultation with a healthcare provider to rule out potentially serious conditions. Monitoring your stool is part of understanding your body better and responding to its needs for care and medical attention. Today we learned about all the things that our stool color has to say about our health. But do you know that general household ingredients or common drinks may offer impressive health benefits? Want to find out more? Watch 7 super baking soda tricks for women every day. Or watch 12 brain-boosting super drinks that help your memory and focus. You may watch either or both of them. Have you ever noticed any unusual stool color that has not been mentioned earlier? Let us know in the comments section below.